Good afternoon, everyone. Dr. Brophy, Dr. Andred, and Mr. Feska. Just would like to open up the meeting and turn it over to Chairperson, Dr. Brophy.
So thank you. I'd like to call the meeting of the Board of Health for April 1st, 2021 to order. I believe we have someone else in attendance today. Mr. Lane, could you introduce yourself, please, to the committee? Mr. Lane, are you muted? Well, we'll continue to move along with the meeting pending being able to have Mr. Lane introduce himself moving forward. So the first item on the agenda is the minutes that are available from the March Board of Health meeting. Can I have a motion to approve the meeting and any discussion about changes to the agenda to the minutes? So motion to approve.
Make a motion to approve it.
And second. Okay. Any edits or revisions? All in favor of
Aye.
approving? Aye. Okay. The minutes are approved. So next item on the agenda is the Copity Vaccinations. The Board of Health is continuing to vaccinate within the city, and I know that the Brockton Community Health is. So maybe Dr. Mondeso, you can give us an update on vaccination in the city of Brockton.
Yes, thank you, Dr. Brophy. And the two entities work somewhat closely together, the Brockton Neighborhood Health Center and the Board of Health. Up till yesterday, we have used the Shaw Center, but we're phasing out our operation there, leading the way to giving the pathway to Brockton Neighborhood Health Center because they are receiving large numbers of vaccines, both from the state and from the federal government, and then assisted by the National Guards. They are requested to do up to about 1,000 doses of vaccines per day. And they're working towards that. But in the meantime, it seems that in order to make way that everything will go smoother over there, the Board of Health, are phasing our operation out and branching out into the community, different venues, faith-based, low and high rises, as well as adult daycare centers and different other avenues to try to vaccinate individuals. So the city has been allocated a quota of 600 doses per week. And this is what we're going to try to work with moving forward to see how we can find people with arms to put those vaccines in.
Any discussion or questions from members of the board?
So basically, you're finding that several different places is better than one, is what you're looking for.
Well, basically, the Shaw Center is a big. Let me say that it's not really a state, a Massachusetts state venue. However, for the city, it's a well-known place, and so therefore, Brockton Neighborhood is given more resources to operate there, and so therefore, in order to not to make it too congested, because sometimes it becomes congested when you have so many people coming for the Board of Health to be vaccinated and for Brockton Neighborhood to be vaccinated within the same place. So we try to find a smaller venues. For instance, we've vaccinated 5 different low rises, the Kennedy Drive, the Earl Center, the Campello's complex. So we do those, and then tomorrow we'll be doing a clinic also at the Westgate Mall. So we try to attract those smaller places, but maybe consistent numbers of individuals the numbers are not always there because it takes a lot to put together a small clinic on a days, few days notice. But that's basically what we're doing right now until probably the whole public becomes eligible by April 19. Any individual 16 years old and up will be available. So in other words, that will include the general public. So we're hoping that that will open more places for people to get vaccinated.
Can I ask, obviously you're advertising these and with appointments made so that you, I imagine some of the logistics, are you still using, could be difficult, are you still using either the Pfizer or Moderna, or have you gotten any of the J&J vaccines? Because logistically, moving, you obviously have the freezer still at Brockton High School and must be moving the vaccinations to the site. Is that correct? Or?
Well, actually, we have freezers and fridge in 3 different places. We have the ultra low freezer at the high school. That's the one that can accommodate the Pfizer. Then we did purchase a second freezer, particularly to be used for the Moderna, which we can set in the negative 20 degree Fahrenheit Celsius. And then we have a fridge over there also. So that that second freezer and the fridge, one fridge is at the Shaw Center. And then at the Board of Health, we have one fridge, scientific fridge, that where we keep, where we warm up the vaccines before we move them to the arms of the individuals. So we started with the Moderna, and then the state reduced the Moderna and increased the Pfizer. However, this week, they did not give us that many Pfizer at all. They give us J&J. So right now we have 900 J&J vaccines, and we're looking forward to try to dispense them between now and next week.
Great, wonderful. That's great news. So, and can I ask, does the Board of Health? I'm just wondering, sort of, you're reaching out to community centers, which is great, and getting out into the community to give these out, which is great because folks that don't have access to get to the high school or the Shaw Center, you're able to offer them an opportunity locally to get their vaccinations. Does the Council for the Elderly or the Board of Health have any listings for patients that are homebound, or ability to be able to help in vaccinating homebound individuals? I know a lot of health centers are now focusing, particularly with the J&J vaccine now, it makes it much easier to be able to go into these into individual homes and vaccinate these patients. So does the city have any listing or understanding in the board of who these individuals may be, or opportunities to vaccinate them?
In fact, we have opened collaborative with Booster Ambulance to do that for us. However, as of Monday, the state has opened up a new program allowing people to call the state directly. They have an 800 number. Let me just pick it up. Sorry, excuse me for a moment. Yeah, so the Massachusetts Department of Health has opened a program. They call it Homebound Vaccination Program. And they have an 800 number, which is 844-771-1628. So anybody who is homebound can call this number, and then they do a little screening for them. DPH does a screening for them to make sure that they are eligible, and then they can request a vaccine at home.
So the state screens, and then they contact you, and then you're able to go out and give the vaccination. Is that how it's working?
Well, so far they have not contacted me, us yet. It seems that they have the resources to just do that, because when I called the number just to verify that it was a working number, I spoke with someone and they told me, well, people call and then they screen them and then they'll get the vaccine to them. So it seems that So far, it seems that it's something that they want to do, and they're not really looking to engage the local Board of Health to do
Got
that.
it. Got it. It's just that probably on our side of the Board of Health, just to make sure that the community is aware of that, the Brockton local community is somehow made aware that that number is available and that they know how to contact them to assist in getting homebound individuals vaccinated. So that would just be an important feature to make sure people in the city know that this is capability of vaccinating homebound individuals is available. And also that you're advertising where your community clinics are going to be and getting people to sign up for the vaccination. So this sounds wonderful that we've got the number of vaccines in place, and that a good opportunity to further enhance the number of people that are fully vaccinated within the city. So, any other questions from any of the other members of the board or?
Just to add to what you just said, Dr. Brophy, it may be well worth, if you haven't already, Dr. Montessor, sharing it with the neighborhood health center, the phone number, and then sharing it with your network of churches so that they can have that number available to give to anybody that people may know that are shut in. It can't hurt. It could help.
Right.
Yeah, thank you, Dr. Andre. Some of the entities that you mentioned already have it. We probably will make it available to the fifth base also, and maybe expand it beyond. But the city, it's listed on the city website as well.
Great.
Great, wonderful. All right. All right, so the next item on the agenda is the dashboard for COVID and sort of an update on our current statistics here in the city. So, Dr. Montessor, do you?
Yes, the numbers dropped. So for over a week now, we dropped down to the yellow color again in the dashboard. However, the numbers are increasing again, unfortunately, because it seems that for the last week, many places across the country have seen an increase by about 20% in the new numbers. And so we anticipate to go back into the red, because once you go above 10 cases per 100,000 inhabitants, and then you have over 4% of positive rate, then that puts you automatically find yourself into the red. So we would not want that, but it seems that it's inevitable for the next days or weeks. I don't know.
Yeah. I took a look at the dashboard today, and yeah, we're getting close to that 4% mark. And also, I wanted to ask about the vaccinations. It says 22%. Is that at least 22% of the Brockton community has received at least one vaccination? Is that correct, or?
Yes, there is a different way that they calculate that in terms of total number in the city, fully vaccinated, and then one dose. And then when they break it down by demographics, so it has a little variation depending which particular factors you look. Yes.
Yeah. Okay. All right. And that I assume that they're also taking into account the in the city. It's not just the community health and what the board is doing. It's taking into account what are the various clinics, health clinics. And providers and that are able to also vaccinate as well. Is that correct, or is it?
Yes.
Yeah.
We have a meeting. The mayor's office, the Board of Health, has a weekly meeting with both hospitals, Father Bill, and Brockton Neighborhood Health Center. So basically, we get updates on what they do in terms of vaccination, and then the state also has a site where they make available the numbers of people who have been vaccinated per city or municipality.
Any other questions?
None for me.
Okay. All right, then, next item on the agenda is health promotion and public health education. Some of the partnerships between the city and various stakeholders, so.
Yeah, we do a lot of outreach. Mayor is very active in this sense. Since our last board meeting, we had several health promotions in education with the media, with Brockton Community Access Channel, with television, two small television stations, community oriented. One is with the Cape Verdean community, one is with the Haitian community. We've met with several churches and pastors who ask a lot of questions about the vaccines, and then we try to answer as many questions as we can. So we do engage them, but I think there is much more to be done because you still have people who are hesitant about the vaccines.
No, it is challenging, and you know, having your advocates in each of those communities that understand and can encourage folks within the community. Certainly, the faith leaders and various groups within the city. It's important to have representation from those groups that have been vaccinated and encouraging others within their communities to be vaccinated. I mean, it's probably the best way of actually reaching out to folks. And you know, you see, at least in the medical center, there was some reluctance in some healthcare workers, but that really has changed as more and more people are being vaccinated, and they're seeing that people are are protected. Moving forward, you know, some of that reluctance has been overcome, and much higher rates of vaccination than on initial, at least in our healthcare system, on staff of initial reluctance that has been overcome. So I think, you know, just keep up the effort. It will take an effort, but the more and more people within a community that are vaccinated at these local events, as many of them as you can engage to spread the word in their community that they had the vaccination, that they're you know, and that to help others overcome their reluctance would be important. So
certainly, thank you.
Any other comments, or?
I have one other. I know, especially in my own business, one great outlet that has changed. You know, a lot of times people don't look at the newspaper, or if they're not going to church, the radio stations, especially the Haitian and the Cape Verdean radio stations. I have a lot of the, I advertise on it, and also I have the names of the different people. People really listen to the radio station religiously in the Brockton area and around. And that would be a great, you know, for your 800 number, and also getting out where the different places are. A lot of people where they don't look at the newspapers, or they don't, you know, go to church, or they haven't got an outlet. That radio station is it's changed a lot. Radio station has a lot to do with things nowadays.
Yeah, well, I don't know if there are any particular radio stations, as you mentioned, that you could maybe refer us to, or you could refer to us. But I know the mayor has made it a priority to reach out, and every time he goes out, or a newspaper, some radio station, some TV reaches out to him, he makes sure that the Board of Health is also there to highlight this.
I can give you some of those names too. I'll be able to give you some of the names, and maybe you can call them, and I'm sure they'd be glad to put it on their show.
Okay. Do you want us to connect maybe offline later?
Yeah, I'll provide those names. I'll drop them off to you so you'll know who to talk to.
Okay. Thank you, Mr. Fisk.
Yeah, it's not just that, you know, there's more and more data about how effective these vaccinations are, but not just the effectiveness, even with the variants around. It's the, you know, it's stopping the serious infections and the hospitalizations. The dramatic drop-off right now that's happening in those that are the elderly that have been vaccinated in the first round most of the hospitalizations now are occurring in people that are younger than age 60. And that's because I think the vaccination, the effectiveness of the vaccination in the older population that have been done over the last few months. So I think, as much as that can be stressed in the community, that, we on a looking at the entire city and the entire country on a population basis, we are seeing the effects of the vaccination right now in the elderly patients, and preventing, the serious infections and deaths that have been occurring. And, this is not just it's not just the deaths, it's the morbidity and some of the side effects that come from this virus, and still not knowing the long-term consequences of the virus is an important thing to stress. I think some people feel like they get sick there's a potential of side effects from the vaccine because it's unknown. The vaccine is unknown. In the medical community also, the long-term effects of this virus are unknown, and clearly the seriousness of the infection and the morbidity and mortality that come from it are known, and that we should stress as much as possible that as we get through this and more people are being vaccinated, it's becoming clearer and clearer that it is a safe and effective way of helping patients to avoid the serious effects of this virus. So. All right, any other? Okay. Next item on the agenda is the request from Shabam Variety concerning their license to sell tobacco products. Can you update the board, Dr.?
Yes, after the board meeting last month, I was able to meet with Solicitor Bridges, who advised that we open up, we provide the license, because as I discussed the matter with her, she did not feel that there was any ground to really retain the reissuance of the license. So we still want to make sure that they understand that the license is not transferable from ownership to city legal name. So that's where we at. And if you have no obligations or no objections or no further questions on that, then I will get back to the attorney for the party for the Mr. Nasrallah, because I already spoke with him. I told him that we received clearance from the solicitor's office, and so therefore probably as early as tomorrow we will get back to him.
So can I, so to clarify, the legal said that what the law says is it is to this owner, and it is not transferable if the ownership changes moving forward. Is that am I correct? Is that what the legal came back saying?
Yes. Officially, a license ceases because it's not transferable to another owner just because the business is changing hand of management. So that's the standing right now. So
okay.
Yes.
Yeah. So a discussion from the board members?
No, that seems straightforward.
No, I think that was the question I think we had. I think none of us were, to give the license back based on the delay, losing the license because of delay in mail, et cetera, and during the pandemic was not an issue. It's just to be sure that we were understood that the license was not transferable and that we conveyed that appropriately to the owner with an understanding that, to activate his license means it's his license, his business reopens, and that if the business does not reopen, the new owner will not have a license for tobacco products. So it's
understood.
Yeah. So and the owner understands this, right? So in your discussion. Okay.
Yes. At least after the meeting, I did not get a chance to speak with him anymore, but I did speak with the attorney representing the owner.
Okay, great. All right. I have objections. Do we need to vote on this to allow the license since it is an exception? The license did expire, but the exception was that it was because of issues with the mail and during the pandemic that this occurred. So I think we probably should vote on this because it is an exception to the law. The license did expire, but we're allowing that license to continue. So if I could have a motion made by somebody on the board and to allow license to be reissued.
So moved.
Okay, just
Second.
a second on that?
Yeah, they've always run a good show and they've been here for quite a while. I certainly go along with it to reinstate it and do it.
Okay, all in favor?
Aye.
Aye. Any objections? So unanimously the board approves reissuing the license to the owner.
Thank you. Thank
Okay.
you.
And then item number 7, one of our nurses is leaving us?
Yes, we had, it seemed that the marriage wasn't a great one for one of our nurses and the environment. And so therefore, there was a small incident that took place, well, actually a couple of incidences on 2 separate occasions. And so at the second one, the individual decided to tender her resignation. So yesterday was her last day, opening up the position again to advertise for another nurse to fill in the vacancy.
Can I ask, yeah, I know the reserve is helping the Brockton Community Health Clinic, but how are you for vaccinators within your department when you go out to the clinics?
Well, we still rely on occasions on the school nurses. We do little help from booster. Even the booster does not vaccinate for us, but they do help in terms of observing the people who get vaccinated for the time that they're supposed to be observed. And then there are 2 nurses, volunteer nurses also, we have hired on per diem to help vaccinate people. So we still use their help to do that.
Because can the fire department help?
I think some of them would be available because there is a level what DPH call advanced EMS, advanced EMT. So yes, they can do that.
There were some municipalities that are using the fire department to support this process.
Yes, except that I don't know how many of them up to par, but I can check with Chief Williams to see.
Can't hurt to ask.
Yes.
Yeah. Because it is, if you're trying to get 600 vaccinations a day in arms, that's a heroic daily effort, given the staff that you have, unless you can get, it's good to hear that you're getting some support from the school nurses, but, it's hard sometimes to cobble all this together and make sure that you can meet the needs of the number of people that are seeking vaccination. So, yeah, so as much as we can enhance that vaccination core, folks that can put needles in arms, to reach out as much as possible to have people help with that are capable of doing it within the city. So.
In a pinch, there's nothing. Don't hesitate to reach out to me. I'm still a nurse.
Yes, thank you. Okay.
I need a little bit of quick orientation as to, depending on the vaccine we're using and all that kind of thing. But again, in a pinch, I'm right here in Brockton, more often than not, working remotely, and can have some flexibility depending on, what kind of notice you give me.
Okay.
Great to hear, Craig. So.
Thank you so much for your availability.
Any other issues?
No.
Nope.
Great. So with that, it looks like we've gotten through most of the agenda. Dr. Montessor, any issues that you need to bring to our attention or before closing the meeting?
Nothing more right now. I think we covered everything. I just put the miscellaneous just in case there was something that maybe any board member would like to highlight, or if there was a last minute thing. But actually, well, let me mention that DPH has sent us a new grant. They have allocated over $200,000. 100,000 will go towards equity to help address disproportionate disparities in disadvantages communities, and to try to get the efforts to get them vaccinated. And then the other 100,000 or so will go in towards salary and infrastructure. So it came just a day ago, and then today was the due date to submit the contract, and then it can be the budget and the additional paperwork will be due in sometime in May. So that's no sum of money coming into the city to help with mitigating the pandemic.
Great, that's wonderful to hear. So you will be applying for the grant.
Yes, we have submitted we have signed a contract. The mayor and I have signed it today.
Excellent. So that's great news. So, all right. Hearing no other issues, I'd like to adjourn the meeting. Have a motion put forward to adjourn, with a plan for our next meeting to be on Thursday, May 6th at the same time at 4:30 in the afternoon. So, do I have a motion to adjourn?
Motion to adjourn.
Seconded.
All in
Second.
favor?
Aye.
Aye.
All right, everyone, thank you. Have a wonderful holiday weekend to those that celebrate the holiday, and hopefully we keep our vaccination efforts moving forward as they have been, and we hopefully next month we'll see numbers coming down rather than going up. So, and everyone, please stay safe, and we'll meet again next month. Thank you all.
Thanks. Bye-bye.
Thank
Bye-bye.
you so much, everyone. Happy Easter.
Same deal.
Bye-bye.
Bye-bye.